Dr. Lisa Goins, nurse practitioner with Couture Healthcare. One of the things about Couture is that we couture the health for you around your individual lifestyle. When you visit a provider, a nurse practitioner, you will come back to an exam room, and that can be very frightening for a lot of people. What is my expectations? What's going to happen to me? What will the doctor say to me? And one of the things that people should realize is this is your time to talk, to explain to the nurse practitioner, the provider, what's going on. At this point, when we come into the exam room, we have already done your blood pressure, your temperature, your pulse. We may have already taken down your weight and your list of medications. We've already taken down your insurance, your home address, how to contact you. But when you come to this part of the visit, this is when the provider is going to sit down with you and ask you what's going on. Now, your chief complaint, depending on the time that you've scheduled for your visit, should be limited but not always all-encompassing. Sometimes when you're a new patient, you have a laundry list of things that you wish to discuss with the provider. That's okay. Just make sure that when you schedule your appointments, you have enough time to talk about everything. If not, then you want to keep it to the top 3 things. I have problems with my kidneys. I have problems with my heart, and I'm having some aches and pains and constipation. Those are 3 things that we can take care of. The other reason that's very important that a lot of patients don't understand is if you start telling 7, 10, 20 things, and I offer you 7, 10, 20 solutions, if one of those solutions doesn't work for you, then I have to figure out of that 7 to 20 solutions, which one was it? So if we can keep it simple and only change a couple of things, see if it works, then we can move forward. So you come in, you say, Lisa, I have a problem with my heart. Okay, we can look at your heart, we can talk about if you need to see a cardiologist, we need to talk about blood pressure medicine, what's going on with your heart. That would be one type of visit. You could just talk about your heart and we can move forward. The next thing is, Lisa, I'm having problems with anxiety. Well, is the anxiety part of the heart problem, or is that separate? Or because it's right here in this area, is it really a GI problem? Do you need one of those famous purple pill generics that we can give you that may not even be a heart problem? So right there's a couple things that we need to iron out. So just like any good baker, you don't want to put too much salt into the cake mix, you don't want to put too much baking soda, and you certainly don't want to forget putting the butter in. Too many eggs, the cake's going to be flat. Not enough, it'll be nice and fluffy. So the same way with the person, we want to couture your health care to respond to you. Now, if you decide to get on the internet, and that's okay, we like well-educated people. We like people investing in their health care. Go talk to Dr. Google, but please come and see me or another provider for a second opinion. Dr. Google has a way of convincing people that everybody's dying in the world of cancer. Not everybody dies in the world of cancer. However, if you do have cancer, we need to get you someplace else in the system so that we can take care of you and meet your needs. So please, if you want to look up WebMD, Dr. Google, or anything on the internet, and Couture Healthcare's website also has many health articles that you can read at your leisure. If you have any questions, comments, concerns, call my office at Couture Healthcare, 513-857-5679, or you can respond on the web page and leave a message. Or with this video, there's comments below, as you'll see down here. Leave me a question, I'll get back to you and answer it. And this is Dr. Lisa Goins, nurse practitioner with Couture Healthcare. It's been a pleasure.